talk about, based on the history, you have to jot down a list of differential diagnosis. You just cannot say that, okay, it is 100% asthma. Maybe based on the diurnal variation, based on the allergic history, based on the genetic history, based on no smoking history, you can say that my patient is a patient of asthma. But you have to rule out other similar conditions also, or maybe other differential diagnosis or other secondary infections. So rule out chronic infections, especially in Indian scenario where tuberculosis is most common. Congestive heart failure. So a patient of COPD, because of this, increase in pulmonary arterial pressure, are more prone to get CHF or congestive heart failure, that we call it as a core pulmonary. Interstitial lung disease for cough, upper airway, cough syndrome, GERD. So if no roll-up for spirometry, if no symptoms is be there, if the patient is clinically stable, so generally the spirometry will come normal even if the patient is a patient of asthma or COPD. So until and unless the symptoms are on the higher side, maybe the patient has developed symptoms, then the spirometry change. But even if the spirometry is normal, you can say that the patient is of a patient of asthma or COPD. So the gold standard to diagnose asthma or COPD is calculating the FeE1 by FVC ratio, forced expiratory volume by 1 second divided by forced vital capacity, and that you calculate it on the spirometry. Less than 70% is the gold standard. And to tell us asthma and COPD, so asthma will show this, which is not there in COPD. So improvement of greater than equal to 12% in FeE1 and greater than equal to 200 ml after giving bronchodilator. So what does that mean? You do a spirometry test before giving any medication. You give bronchodilator, and especially we give a short-acting bronchodilator like salbutamol, levosalbutamol. And then after giving a bronchodilator, maybe after 2 or 3 minutes, you re-perform a spirometry. So a pre-value of this versus a post-value of this, and you compare the values. If there is improvement in this values, that means the patient is of asthma.